What I'm most passionate about, obviously, is taking care of women. So I'm a huge advocate for women's health and for women speaking up for their own health. I'm Alicia Shields. I'm a board certified OBGYN. Our practice is unique in that we are for women and we all practice a very similar way. We all have the same kind of beliefs and practice etiquette. We all put the patient first and we're very available for questions, and there's always someone who's on call. But I think the care that they receive from our office staff, from our nursing, from the physicians and beyond is kind of a step above what other places will offer. I think the people that you get and the care that you get is far superior. Our procedures really range from simple office procedures all the way up through major surgery. We're doing things like endometrial biopsies, we're doing pap smears, we're doing colposcopies, which is a procedure we do, and then something called a hysteroscopy, where we actually put a camera inside the uterus to look around and see if there's something abnormal going on. I've been well trained in doing laparoscopic procedures. And so that kind of runs the gamut from taking out an ovarian cyst or taking out a whole ovary for women who don't desire childbearing anymore. And then we get into the hysterectomy, and that we do minimally invasive. And then we can also use the robotic platform. That also gives us a lot more capability to do a little bit more advanced hysterectomies. When a patient comes in with a specific problem, whether it's heavy periods or pelvic pain or whatever the situation may be, I like to work through with them all of the options that are available that range from doing nothing all the way up through surgery. But a lot of times there is a middle ground where patients can be managed on medication or some hormones. There's some new medications coming out for treatment of things like endometriosis. There is a newer medication for women that have heavy periods or heavy bleeding with fibroids that we're starting to get some patients involved with. I'm excited to try some of these medications for our patients coming down the pipeline. At the end of the day, when I take care of women and see that they're able to live productive and healthy lives, whether it's getting through pregnancy, taking care of any issues they may have, and feeling empowered and comfortable in my care, I think there's no better compliment than that.